Hi, my name is Dr. John Sackness. I'm a dentist here in Washington, D.C., and I'm the owner of Dental Bug. There are several other people that have similar type of devices, but SPECTRA really seems to be the best product out there. It allows us to be able to record and at the same time show the patients exactly using a numerical analog to determine what exactly the patient has so we can compare it to the future.
With the SPECTRA, I can show the patient what I am seeing. I really value patients seeing their own tooth, their own circumstance, because it makes it easier for them, I believe, to feel comfortable with the treatment that I'm recommending.
Caries detection is another way of saying cavities. We're trying to look to see how deep the cavity goes within the tooth structure, and that is a benefit of the SPECTRA through our techniques in the sense that they're able to come up with a number so that we can compare that number or value now and compare that 6 months from now.
It puts the number map on there, and then I can point to the different areas where I see numbers that are significant and talk to them about whether or not we recommend treatment at this time or we should check it again in 6 months.
We use the SPECTRA by Air techniques as one of those devices to allow us to show patients what is going on in their mouth, to allow us to better diagnose what's going on and show the patient ultimately what kind of treatment they're going to require. And that allows us to determine the depth of the bacteria within the tooth structure to help the patient make the decision whether they should move forward with getting the treatment. And so the SPECTRA, because of its analysis, is able to determine the depth of the bacteria within the tooth structure. And so as a practitioner, I'm able to tell a patient, yes, you have a cavity, and this is approximately how deep it is, and this is why we need to move forward with doing it. If it's just a stain and using a regular camera, I am unable to do that, and therefore the patient may not know how severe the situation is.
The patient education portion of it and the visualization portion of it are, I believe, the most valuable difference between the two products.
Now we're able to show a patient on a 39-inch monitor exactly the tooth with a picture that we're able to take. We're able to show them exactly where the cavity is forming, and they're able to understand exactly what's going on within their own mouth.
You know, working with patients and working with staff, people have been really excited and interested and happy to use it.
I think that every practitioner should have this in their toolbox to be able to help patients with the education as to understand why it is that they have a cavity and when it is that they need to go ahead and get that cavity taken care of.
Would I recommend the SPECTRA to other dentists? I would. I really like it. I've been using it for almost a year at this point. It's just another way for me to help my patients, which is the thing that I like about it the most.
I love the SPECTRA product. We've been using it for over 2 years now. We have it in each one of our offices. We use it every time. It's something that cost effective. We can move from room to room. The doctors like to use it, the hygienists like to use it, and patients like to see the results from it.
For more information, please call or visit us online.